It is a disease that only having one of 3 signs brings a 72% chance of it being a health emergency, and it requires you to act fast. May is National Stroke Awareness Month, and in tonight's Eye on Health, WSBT 22's Ann Reese shows us how knowing the signs can save your life or the life of someone you know.
He's got 9 hits now in his last 5 games.
It's America's favorite pastime, baseball. And if you live in Michiana, you've likely been to a game to watch the South Bend Cubs. But between the cheering and the fireworks, Luis Fraga, a Ph.D. and director of the Institute for Latino Studies at Notre Dame, never thought it would be a baseball game that would save his life. It started last November on a normal day for Fraga.
It was a weekday. I left work and I went home, had dinner. When I went to bed that night, I had a very severe headache behind my right eye.
A headache he wrote off as a sign of sinus issues. Not anything unusual until he woke up the next morning.
But I noticed that I had some numbness on the fingertips of my left hand, that I had some numbness in this part of my face, jaw area. And then when I got out of bed, I went to the bathroom and noticed that I was having trouble seeing out of my left eye, that my left eye was cloudy.
He was still able to walk and talk. He didn't look any different, but he could feel something was wrong. That's when he headed downstairs to the bedroom of his son, Tomás.
He came into the room as I was getting dressed, sat down in a chair I had, and said, "Son, I need to tell you something."
As his dad described what was happening, Tomás remembered an acronym on the jumbotron at a South Bend Cubs game years before that spelled out FAST, or fast, face drooping, arm weakness, speech difficulties, and T for time to call 911. And that's what they did. The father and son were met by Dr. Jose Lopez at Memorial Hospital.
When a person comes in for stroke, the immediacy is to confirm that we're not dealing with somebody who has suffered of a hemorrhagic stroke, ensuring that we could continue to consider a patient's eligibility for a medicine that can dissolve the clot, and or be able to then identify a clot and be able to remove it.
After being examined, it was determined Luis had an abnormal heart rhythm due to defective valves in his heart. He spent 10 days being treated and observed, and since coming home has continued various types of therapy. But he's back at work at Notre Dame part-time and happy to be teaching political science again. He still has some fatigue that he happily says he can cure with his afternoon nap. But with some help from his wife and son, he feels lucky that he was able to get back on his feet so quickly. He now has heart surgery scheduled to fix the issue. It's an outcome Dr. Lopez credits in part to something so crucial when responding to a stroke: time.
When we have the opportunity of time to our advantage, we have 4.5 hours from when the symptoms started to be able to administer a medicine that could dissolve the clot and potentially make a change in the outcome of that patient.
Dr. Lopez says Memorial Hospital is, within a 70-mile radius, the only hospital certified to remove clots from the brain. It also has the highest regional level of care in the context of capacity and certification to remove clots, and that it all comes down to knowing the signs. That's why, among other awareness efforts, Beacon hosts the South Bend Cubs Strike Out Stroke event, and how an acronym lit up on a jumbotron saved a life.
I know for sure that I would not, and my son Tomás would not have been as quick to react had we not seen and heard those information sessions before.
I don't think I would have immediately said, we need to call an ambulance right now. Everyone should know what these signs are.
If not for you, for someone you love. For this month's Eye on Health, I'm Ann Reese, WSBT 22 News.